I'm setting up a little demo, shout out Danielle for my demo tray. Bless you. Love you, mean it. I just want to talk about how I prepare for a case as an ARRT tech with 20 years experience. So the first thing I do is I'm gonna open the chart. Let's see what is in here. First thing I'm gonna do is open the chart, check the consent, and I'm gonna go under the media tab where they scan in like the actual order, and I wanna cross-reference that with the order that's in that I can see. I was burned one time 10 years ago when the order said just like Metaport placement, and we didn't double check the order from the doctor's office, and they actually wanted a double lumen port and not a single lumen port. So we put the wrong port in, and then ever since then, now I have to go in and check every single time. I have never caught anything since, but it's always better to check. So that's my first thing. My second thing is double checking the consent. You're gonna have to stay tuned for this demo video. But I know it looks like I have a science experiment going. The second thing is gonna be consent. Make sure that's signed by the physician, the patient, and a witness. The next thing is gonna be checking any allergies, making sure that we are not gonna be using anything they're allergic to. I'm also gonna check any pertinent labs for the case. So if we're making a puncture, I'm gonna care about their coags. If we're injecting contrast, I care about their renal function. So stuff like that is our major thing. After that, I'm gonna review any previous imaging that they have on their chart. If you're doing a central venous access case, it's great to look for any upper extremity ultrasounds or central ultrasounds. That's gonna tell you if you have any clot, any occlusions, things like that. It's very helpful for these cases. If we're doing a more advanced case, then I'm going to check their CT, their MRI. I'm gonna read through the dictations. Now I do this quickly. Sometimes I'll just scroll down to the impression if we're really in a pinch for time. But I wanna have like a full picture of the case before I just go pulling supplies. If we have treated that patient before, I'll also see what we used, what balloons we used, what stents we used, so I can have balloons the same size. Like if we're treating like a recurrent lesion, I want to have the same size in the room so we don't have to waste time with the physician saying, like doing the angio, seeing what we need, and then going to run and pull those things. After I've done a full lay of the land, consent, allergies, order, labs, then I'm gonna go talk to the physician and say, hey, what's your plan? I was thinking about pulling these supplies. Do you need anything additionally? And the reason I like to look through the chart before I do that is because I want them to know, like, I'm invested in the case. I care about this case. I want to be informed. So it just makes you a little bit more respected as a member of the team when you go the extra mile to do that. After that, I'm going to go ahead and back to the room, set up my room for the case. I like to do everything I can before. So prep the injector, do the pressure bags. I like to set my table up if it's not an implant. Of course, for like a port, I'm not going to set the table up until they get in the room, or an endograft or anything like that. But if it's a routine embolization case, I'll go ahead and get that all set up so no one's waiting on me when the patient rolls in the room. And when I talked to the physician, I am also going to ask him about approach and if we need any reps for the case. So do I need to place the patient prone? Do I need to flip the room? Is there a rep lingering somewhere in the hallway that hopefully is here if we need them? So those are the things I ask, and let me know if I missed anything that is on your mental checklist.